So this video looks at Rosenhan's 1973 study. Now, this is your classic study for the clinical approach. It means it's very, very likely to be on your exam. So please make sure that you know this from start to finish, both describe and evaluate. Now, Rosenhan's study demonstrated how diagnosis can have good reliability but poor validity, and we're going to go through that in a second. It is worth remembering, though, that this study was over 30 years ago and that the diagnostic procedures have massively improved since then, and that this study does not reflect the current health system. Okay, the aim of Rosenhan's research was to tell how well psychiatrists could distinguish between real patients with schizophrenia and 8 sane people who didn't have schizophrenia who gained admission from 12 different hospitals by faking a single symptom. The procedure involved 8 pseudo-patients, so they were the people that didn't really have schizophrenia. There were 2 women and 5 men, and one of them was Rosenhan himself. One was a 20-year-old graduate, and the other 7 were older and included 3 psychologists, a pediatrician, a psychiatrist, a painter, and a housewife. The mental health professionals provided a different occupation, and all of the participants used different names, and some personal life history was changed. Other than this, the patients gave entirely details about their own life. In the first procedure of the study, the participants arrived at a total of 12 different hospitals in 5 states of America reporting one single symptom, hearing voices saying empty, hollow, and thud. Once admitted, they then started acting normally, cooperating with staff and seeking to be released as soon as possible. When they were asked, they reported no further symptoms. They did not swallow the medication that they were given, and they recorded the responses of doctors and nurses when they spoke to them. Now, all of the 8 pseudo-patients were admitted to the hospitals, and they were never detected. The average stay was about 19 days, and the range was from 7 days to 52 days. In every case, they were all released with a diagnosis of schizophrenia in remission. 3 pseudo-patients had their writing or their note-taking diagnosed as an aspect of their pathological behaviour, and I quote, "The patient engages in writing behaviour," was recorded on their files. In 30% of the cases, real patients had made comments to the effect that the pseudo-patient had nothing wrong with them. However, in no case did the doctor or nurses notice that there was nothing wrong with the patients. This is unsurprising, as 71% of the doctors and 88% of the nurses ignored the pseudo-patients when they tried to talk to them. It is worth noting that Rosenhan suggests in general doctors are more likely to err on the side of caution and therefore call a healthy person sick rather than a sick person healthy, which may explain these quite shocking results. In a follow-up to Rosenhan's original procedure, staff at another hospital were informed that one or more of these pseudo-patients would present themselves again over the next 3 months. Staff at the hospital rated the new patients on a scale of 1 to 10 for how likely they were to be a pseudo-patient. There were in fact no pseudo-patients during this time, but the idea was to see how many real patients would be misidentified. The result of this were that 193 genuine patients who presented themselves to the hospitals across these 3 months. 41 of these, a member of staff was confident that they were a pseudo-patient. Remember that in fact there were no pseudo-patients at all, severely questioning the validity of diagnosis. Now, the study revealed 2 major weaknesses in the psychiatric system of that time. The environment clearly has a major impact on the process of diagnosis, and in the hospital environment, staff could not tell the mentally disordered from the mentally healthy. Equally, once labelled with a condition like schizophrenia, patients find it really difficult to escape that label and to be judged or seen as normal again. It is unlikely that someone is insane all the time, just as people are not angry all the time, apart from me. However, it seems that once a person is labelled insane, all the behaviour is understood through that label. Mental illness is treated very differently from physical illness, as it allegedly lasts forever. Now, the strengths of this procedure, the kind of hospitals used were varied so that there could be generalisation of findings. There were 12 hospitals used, which strengthens the findings and allows them to be generalised. If they'd only just used one hospital, then it may have been difficult that the hospital alone labelled the mental illness and therefore made it difficult to generalise. But by using 12 hospitals across 5 states, we can say that it's generalisable. Also, the design of the research was really simple. The pseudo patients just had to be themselves, so it's really unlikely that any treatment of them was due to their behaviour being similar to someone with a mental illness. The fact that some of the bona fide patients realised that the pseudo patients were not mentally ill backs up this observation and suggests that their behaviour was validly normal. By using 8 people in 12 hospitals, the study was replicated and the same results were found. This therefore means that the study can be regarded as reliable. The findings are really strong as well. The labelling was clear, and the idea of people being perceived through the labels as clear as well, it's likely to still be the case, although the study was carried out over 30 years ago. In terms of weaknesses, the pseudo patient said that they'd heard voices, which is a standard symptom of schizophrenia, so perhaps it isn't surprising that they were considered to have schizophrenia. Also, it's not surprising that the patients were misidentified in the second part of the study. Staff were wrongly informed, and these lies are likely to have guided the results of the study and therefore mean that they're not natural and therefore not valid. In the 30 years since the study was carried out, institutions have changed their working practices considerably, and there is a great deal more emphasis on care in the community, so it may be wrong to conclude that mental illness is still difficult to diagnose.